Hello, everyone. I am Constance Lyles Brown Willingham, and this is Main Street with Constance. Today, we've got a guest speaker, Glenn Carnegie, and he'll tell you about his title, his job, the things that he does to help the community here in Bledsoe. So, we have community partners, maybe a lot of people not aware of that. Better Bledsoe, for a couple of examples, the Bledsoe UT Extension Office, and the Bledsoe Food Bank. All these groups work together for the good of Bledsoe to keep us going, right?
Mm-hmm.
So COVID was kind of tough, and has
Tough.
been, yes, no doubt about that.
Right.
So Glenn, tell me, what's your title?
So I'm a regional director for the Tennessee Department of Health.
Okay.
The state of Tennessee basically breaks the 95 counties into 6 metropolitan health departments and 89 then rural counties that are broken into 7 regions.
Okay.
So while my office is in Chattanooga, they have a Chattanooga Hamilton County Health Department.
Yes.
So they're independent of us. We run then the 10 counties surrounding.
Okay.
So we cover as far west as Franklin County, as far east as Polk County, and then all the contiguous sort of northern counties north of Hamilton County. So Ray, Meigs, Bledsoe, Sequatchie.
Okay.
There's 10 of them total.
So in our discussion previously, we've talked about just increasing the community's awareness of some of the things that we do in this county,
Mm-hmm.
some things people are just completely unaware of, and the support that we have out of Chattanooga, I think that is tremendous. We couldn't have survived without that support, from my perspective, looking at all the things that had to be done during,
Right.
especially during COVID.
Right.
So, what are some of your thoughts about, you talk about increasing the awareness of the community. There's still things the community needs to know about, but how do we do a better job of getting that out to the community?
You know, I think anytime we have an opportunity to talk about what the local health departments provide in terms of services, I think people are always kind of blown away by that.
I know I was.
We offer sort of your traditional public health services like childhood immunizations, the Women, Infants, and Children's program, which is a supplemental nutrition program for women, but we offer things like dental.
Yes, that was a
very
big
beautiful dental
eye-opener for
opportunity.
yes,
right.
it is. It is fabulous.
Yes, it's probably one of the best views in town when you're sitting in that dental chair. So we have dental services provided here 2 days a week. We have family planning. We have a program to help pregnant women quit smoking if they're
Yes,
smoking.
yes.
Called Baby and Me Tobacco Free. We do birth and death certificates. We even do voter registration at the health
I didn't know
department.
that. I knew
Yeah.
about the death certificates, and you can get your birth certificates also.
Absolutely. Uh-huh.
So I wasn't aware of that. I was like, whoa.
No, and that was something that over the years has transitioned to being something that you can get locally. Yeah, it used to be that you'd have to send off
Yes.
to Nashville and get
And
those, but
via mail.
now that's all done locally
I think
at our
that's
health
great.
departments. And here in Pikeville in Bledsoe County, our staff is fairly small because
Yes.
it's one of our smaller counties. But when the COVID pandemic started, we were able to really augment the local staff pretty significantly. Most people know that the National Guard has helped us step in. They've been a
Yes.
tremendous help across the entire state of Tennessee, but here in Bledsoe County as well. We were able to use federal COVID dollars to hire temporary staff. We still have some temporary staff on hand giving the COVID vaccine so that our staff can return hopefully to some of their normal services
What
again.
is normal?
Anymore? Constance,
Who
I don't
knows?
know. I don't know.
It's just a
That's
guess.
a good question.
Okay. So what do you do specifically for Bledsoe County? It's one of your
Yes.
many.
Well,
How do you help us?
So part of the new health department, the funding of the new health department was a partnership between
Yes.
Bledsoe County government, the Tennessee Department of Health, and then an Appalachian Regional Commission
Familiar with that.
grant,
Yes.
which is a federal grant that allowed us to build the new health department that we're really proud of. It's
know.
the prettiest health department in Southeast Tennessee.
Tennessee, all
I think
right.
it's probably one of the prettiest in the state of Tennessee right now.
All right.
So our commissioner's actually coming on the 23rd to see it.
Okay, good.
And she's going to be visiting Bledsoe and Ray counties both to
Okay.
really just show the appreciation for the work that's been done. As far as what do I do specifically?
Well, I did a tour of
yeah.
the original building
Right.
first,
Right.
and then I was able to, one of the people who got to vote on the outside layout and
Yes.
things like that.
Yes.
So then I went to the grand opening also, so
Right.
very impressed.
We did a little what they call a charrette, which I'd never heard of before. I didn't know what a charrette was, but that was where you were able to come in and see the different renderings of the front of the building,
Yes.
where we're going to do brick,
Yes.
where we're going to do,
Yes.
and it's so between Mayor Ridley and the contractors here in
Yes.
town. Farmer,
Yes.
Morgan, I believe.
Farmer Morgan
They
and
did an
Company.
exceptional job. So we're really pleased with that. Let me get back to what.
I'm sorry, go ahead.
No, I'm fine. So my position is to obviously to hire the management staff.
Mm-hmm.
We have a new county director here, Vicki Carr, who was over Bledsoe, Meigs, and Ray County. Retired after 30 years. She retired in January.
I heard that, yes.
She's to really be credited for a lot of the finishing touches of the health department. She did a fantastic job from beginning to end. Now we're very pleased to have Lindsay Hathcock. Lindsay comes to us. He spent 25 years as a chiropractor. Practicing chiropractor, so he managed his own clinic for 25 years. He then went to work for a local county government in Bradley County, worked for them for several years. We're very pleased to have him on board. He never meets a stranger. Everyone he meets, he's just got a big old kind heart. He's a big teddy bear is what I always say. But he's excited about being on board. We have an excellent staff at the Bledsoe County Health Department. So we help that staff with managing all sorts of the various programs that we offer. There might be changes that come down the pike about immunizations, and so we get that information. We have immunization manager at the regional office sort of take and translate that information, pass that along to the local staff. We manage funds, obviously, that come from different programs, like the COVID.
Okay.
COVID's a perfect example of that, but there are other. Sometimes we get an increase in WIC funding for certain things and bring about those kind of changes. We bring new programs to the table, like the Baby and Me Tobacco Free. That was as a result of getting Tobacco Master Settlement dollars. So it kind of filters down through the regional office from our central office, and then obviously comes down then to the local level. So we really, what I always tell our folks in the regional office is, we don't have jobs if there aren't local health departments. So we're there to completely support what happens at a local level, purchasing, billing, things along those lines as well.
Okay, that's good.
Mm-hmm.
We talked about, we have a lot of new people that have moved in. I've seen an increase of new farmers in the area, things like that. Keeping everybody up to date and current is a challenge. And every day I see all these questions, about from schools to things like that. And I thought, well, they're supposed to be sending you something home with the kids, things like that. There's a lot of gray areas with new people coming in as to where do they find out information. And so looking at all the things that the Bledsoe County Health Council does, pretty much about every 30 days there's some type of project that month.
True.
Where we're trying to increase the awareness. And that's one that we need to do a better job of. So like the Take Back the Drugs, we have a day for that, various activities, and then also the training that we get out of Chattanooga for the Narcan training. We get that. All the emergency responders, the police, they actually get the training. During COVID, it was virtual, but they still got the training and everything. And then they get the supplies that they need. Things like that. Those are things Does everybody need to know, or just aware that we have that capability to do that? You know, give you a good feeling that.
Yeah, educating the public is becoming, I think, it's easier but harder in some ways too. Easier because we have opportunities like this.
Yes.
Which is great. We would not necessarily have had these opportunities, 10, 15 years ago to just put together something ourselves and put something out. But there are so many sources now, and
True.
trying to manage how to get all that information out. The Bledsoe here has been fantastic to put our press releases out because we've had constant changes with
Yes.
our vaccine,
Yes,
and the
yes,
testing.
yes.
Where could you go to get tested? What days were we testing? What days we giving vaccine? What are the various eligible
Well,
age groups and
yes.
things like that. So it's a constant challenge. I think it's something that we hope to commit more to in the future in terms of trying to figure out how to really utilize, especially social media now, because that truly is one of the
Yes,
biggest
yes.
ways that people learn about things, and trying to do a better job in working through those avenues to get information out.
Okay.
But let me mention too, Constance, the health councils. I didn't mention that before. Little bit of my history too. When I first started in the early '90s was when the health councils first started in the region, and that was my job, was to be a health council facilitator. So
Okay.
back then I would come to Pikeville. We would meet at night. We met at the Electric Co-op conference room
okay.
down the way. It was probably one of the only rooms available outside of maybe the courthouse. Met with Tom Farmer, the
Yes,
former educator.
yes.
He and his wife were real involved with the health council. So really the health councils have been in formation for about 25 years. And we have a lot of folks that literally were involved in those early days, and they've continued to stay involved.
Yes.
And what we found too is that the facilitators that we hire, like the Jan Frichette's of the world, who
Yes.
does such a great job here,
She does.
many of them have gone on to fill even more key roles
Roles?
with us. We
Okay.
have several county directors that have been health educators. It really gives us an opportunity to address the issues that really do affect local residents. It helps us make those connections that are really invaluable later on as we start to do things like, well, let's build a new health department. Well, who else do we need to have involved with that? So the health councils have been an invaluable asset, and I think we're going to see more. We're going to see more resources through our department coming towards those efforts as well.
Okay.
So when you do have a drug take back day, we'll be able to do more in terms of social media. When built environment is one of the newest sort of topics where we're looking for opportunities to fund projects in the community that help people get out and walk.
Okay.
Before we started all this, before we started built environment, we had some counties in our region that literally didn't even have a walking track. They really had nowhere for folks to go to even
Okay.
exercise if they wanted to. So that's another opportunity, and I know Mayor Ridley's got some ideas as well about
Yes.
some future projects, and
Yes.
we're going to try to help him with
Yes.
that. So.
Good. I like that.
Mhm.
Dr. Lee is one of our
Yes.
chairs for
Mhm.
the Bledsoe Health Council.
Mhm.
Very actively involved. He
Very.
passes out good
Very.
tips, especially during COVID.
Mhm.
People had a lot of questions about vitamins and supplements and things
Mhm.
like that. So Dr. Lee was able to make some suggestions, recommendations, and he is very involved in our community.
Yes, he
We're
is.
thankful to have him.
It's not always that because I cover 10 counties that I hear so much about a particular community provider. I've heard so much about Dr. Lee, and I've met Dr. Lee, but he does so much for this community. And
He does.
those are the kind of resources that are just invaluable to especially small communities.
Yes.
And anything that we can do as a department as well. We have student loan repayments. We have practice incentive grants that we can help small communities recruit good providers like Dr. Lee.
Okay.
Physicians. We do a survey every year to try to determine where in the state we have kind of low physician to population ratios, and where we have those, then we can offer some added incentives. So
Okay.
it's another resource that
yes.
folks may not always
Okay.
know a lot about, but the department's been doing that for about 25 years.
Okay.
So been helping try to recruit providers to underserved areas. So he's a great example.
And we have a number of community partners. I work with several of them. Better Bledsoe, the Bledsoe UT Extension Office, and the Bledsoe Food Bank. Looking at the goals, objectives, things like that, Better Bledsoe, their goals are tobacco cessation, healthy activities, and eating healthy. So those are fairly simple, can be challenging, but they work with the farmers market and a variety of the other organizations in town. So looking at that, Fall Creek Falls, Friends of Fall Creek Falls, they're a nonprofit, but they do a lot of healthy activities that they sponsor. So you can check them out. They do walking, wildflowers, things at night, getting you out to be active.
Park rangers have gotten on board with that.
Yes, they have.
Yeah, that's pretty creative.
Wildflower tours, educational, fishing, even golfing. So there's no excuse for, well, I don't know where to go. We have those things already. You just need to reach out. And you can also, most weekends, find some of the Friends of Fall Creek Falls at the farmers market on Saturdays.
Oh, really?
If you're interested, you don't have to drive to the park or go anywhere. Check out the Pikeville Farmers Market, open 8 to 1 every Saturday, and you will find a group there who will give you brochures, help educate you on when they're doing some of their projects and things like that. That's part of being community partners supporting each other. They do a lot of things, more than I thought they did.
And I've been amazed with it too. We've had meetings in the past with the park rangers when we've talked about things like physical activity, and one of the things that I know they've tried to promote is even doctors writing scripts, not for prescriptions, but the script that says go out and walk in nature every day for a half hour.
My doctor gave me one.
Yeah.
I have to walk a certain amount of hours every a total for the month and things like that. So yes, there's more of that happening. Writing out a little piece of paper for you. This is what you need to do weekly, monthly, that sort of thing.
Right.
So yes, I like that. So I wanted anything else that you think of you need to share?
Oh golly, no. Well, I want to say how much we appreciate the residents of Bledsoe County in supporting what we do. We are back open for business.
Good.
We're in the new facility. All the services that we've talked about this morning are back, kind of full force now.
Okay. Good.
We will ask probably that you wear a mask just because we still have a healthcare facility, and at some point we'll certainly see that. We'll see that loosen up as well. But we're back to full services. We appreciate the support that we got from the EMA here in town as well.
Yes.
They were fantastic partners in helping us set up at the fairgrounds. The fairgrounds themselves for letting us be there.
Yes.
We took up their space for a good number of months. And just want to tap my hat to the Bledsoe County Health Department staff.
Yes.
Michelle Holland, our nursing supervisor there, Barbara Root, our office supervisor. I mentioned Jan Frechette. Kayla's our nurse assistant. We just have a fantastic staff there, and I invite everyone to come by and see our new health department and see if there's any way that we can help.
If you haven't been there, you need to check it out. It is
pretty nice.
Awesome.
It's pretty nice.
I have some thank yous I want to give out. I mentioned about the Bledsoe UT Extension Office. We have a new family consumer science agent there, Nancy Malls. And monthly, she's been going to Piggly Wiggly and handing out recipes. We talk about eating healthy, so there's no excuse when they publish it on Facebook and wherever. You need to go to Piggly Wiggly. She will hand out recipes. Any questions that you might have or anything like that, she will discuss that with you. She's doing this on a monthly basis right now. The Extension Office is one of our community partners. And also want to thank you to Nancy, but thank you to Piggly Wiggly. I talk about, we have the largest wholesale producer in Bledsoe County. It's a farm. Their items, they have a facility on site where they flash freeze, and then it goes immediately to the vendor. Piggly Wiggly has that called Pick Sweet. They've changed their packaging. It's still red and white, but they've kind of jazzed it up a little bit. And as before, I said, if there's something you want and you don't find it there, you need to go talk to the manager. So evidently, a lot of you have spoken to the manager. If you've not been to Piggly Wiggly lately, they have expanded their frozen food section like you would not believe. The options, the variety have it tripled. So, and this is a good thing. We're still supporting our local farm community as well as eating healthy. So that's, and it's called Pick Sweet. So that is fabulous. And also, yes, Walmart carries it also. So they got the heads up, I guess, I don't know, from Piggly Wiggly or whatever, but they kind of expanded their frozen food section also. So they now carry more of the Pick Sweet products. So this is a Bledsoe County farmer. Yes,
right.
They are the largest wholesale of produce in the United States.
Wow.
That's a lot to be said for.
Yes.
And if you're not
Right here in
supporting
your own backyard,
in your
right?
own backyard, that was like one of the first things I learned when I came here, and I was like, whoa. So I tried some, and my husband goes, oh, this tastes like you just picked it yesterday. So it's fabulous. And in their new packaging, yes, they give you directions how to prepare, but they've added some recipes to it. So they've upped their game.
That helps.
It does. So thank you, Glenn. This
Well,
has
you're
been
welcome. Thank you for
great.
having me.
Maybe we need to do this again.
Well, I think we do.
Okay, great. So Friends of Fall Creek Falls also have healthy activities also. And just a big thank you to Pikeville, Bledsoe County for the feedback that we're getting. Some of it's on Facebook, some of it's one-on-one, face-to-face. But be sure to like, share, subscribe to Bledsoe Telephone Co-op YouTube. This is where you'll get all this information, in addition to on Facebook. Anything
Great.
else you can think of?
No, I think we're good. Thank you for
All
having
right,
me.
we're good. Thank you. We'll catch you later. Hey, everybody. More information on Main Street happenings? Check here. Main Street with Constance.
Cooperative, your full-service telecommunications provider right here in the Sequatchie Valley.